Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Attico antral disease, and we're looking at the signs of the impeding complications. So, to begin with, pain. So, in terms of pain is a sign. So, what are the complications? The complication, it includes the extradural. It can be extradural. Next is the perisinus. Then it can be the brain abscess. Next is the vertigo. So what about vertigo? The vertigo is the complication is a labyrinthine fistula. So vertigo is going to be the labyrinthine fistula as well as a labyrinthitis. So this is vertigo, labyrinthine fistula as well as labyrinthitis. Next is the persistent headache. So what about the persistent headache? The persistent headache can be the complication of the intracranial. So it is an intracranial complication. So facial weakness is seen in facial paralysis. Next we look at fever. So fever will be seen in the intracranial complication. And nausea, vomiting will be seen in again the intracranial complication. And looking at neck rigidity. Neck rigidity will be seen in meningitis. Then diplopia. Diplopia will be seen in, there is a syndrome which you need to know, that is a Grade-Nigo syndrome. There is a Grade-Nigo syndrome. So there is a Grade-Nigo syndrome as well as there is a Petrus or Pesitis. Then ataxia, the sign of ataxia. This is related to the labyrinthitis as well as the cerebellar. So it is associated with the labyrinthitis, the cerebellar abscess. Next we move on to the abscess around the ear. So abscess around the ear, the complication, it is the mastoiditis. To learn and grow daily like this, please do subscribe.